I'd like to introduce myself. My name is Winifred Schultz-Krohn, and I have the privilege of serving as the chair of the Occupational Therapy Department. And I extend my sincere welcome to everyone attending our 75th anniversary celebration. I know, it's pretty amazing. We have a really wonderful afternoon planned, and the keynote speaker, along with all of the session speakers, are alumni of San Jose State University Occupational Therapy program. So we are very proud of all of our alums, all of our former students, and thank you so much for your dedication to the program. We have three very distinguished individuals who would like to welcome you to this event. Our first welcome is provided by Dr. Joan Fickey. Dr. Joan Fickey is the Interim Provost and Senior Vice President for Academic Affairs at San Jose State University. She has 45 years of experience in higher education. At Mount Clair University, she served as a Dean of the Graduate School, Senior Vice Provost of Academic Affairs, and Associate Vice President for Academic Affairs for Personnel and Resource Planning. So able to juggle many hats, obviously. She is a professor of community health with experience in health policy, the administration of healthcare facilities, health counseling, and women's health issues. Dr. Fickey is especially focused this year on implementing a new research, scholarship, and creative activities reassigned time program that will allow our faculty to pursue their scholarly agendas while also providing our students with the conceptual skills they need to succeed in their careers. Please help me welcome Dr. Fickey to the podium.
Thank you, Winifred. 75 years, wow. Again? Come on. Doesn't happen that frequently. It's a big deal, and congratulations deeply, sincerely, for that 75 years. And so, Shawn, you've been here 75 years? No. Oh, okay.
74.
All right. I won't play with that too long. I'm delighted to be at San Jose State this year, in large measure because my professional experience in New Jersey at Montclair State University is very parallel to what you folks do here. Montclair State is an opportunity institution. You are an opportunity institution. And so I'm grateful and really privileged to be able to spend some time with you as you do the work that's so useful and meaningful for our students, those at Montclair State, those who come here. You did hear that my discipline is public health, and when I'm not in an administrative capacity, I spent many years as a faculty member in community health. But more importantly, as I was thinking about this morning, I wanted you to know that I'm a bit of a hospital rat. My mother was a nurse. She had been a nurse, some of you know this, have heard it before. My mother had been a nurse for 55 years. She was a single mother who raised 3 children, and a big deal for me was to join her for lunch some days at the hospital, which was in the neighborhood that I grew up in Paterson, New Jersey, and share stories that I heard. You can imagine the stories that I heard at a lunch among maybe arguably somewhere between 4 and 8 nurses who trained, my mother trained and completed her training in 1933. So I very proudly wear this nursing pin. That was her nursing pin, in large measure because of the experiences that I had, not only as her daughter, but as the daughter of a nurse who grew up around a hospital, who grew up around healthcare. So when I was thinking about this welcome, I was remembering back to a program that I had participated in when I was more actively involved as a faculty member in Public Health Matters. And there was an individual, and I can still see him in my mind's eye, who was a physician, who was speaking to the audience about the merits and the values of what we do when we work with patients. And he used this phrase, which I've never, ever forgotten. He talked about then, and it was in my mind this morning when I was working out, the crucible of the bedside, and the honor that we have to participate with clients and patients when they are probably at their most vulnerable and most needy. And that's what you do. That's what occupational therapists do. That's what physical therapists do. That's what physicians do. That's what nurses do. I do believe it's an honor, and I do believe it's a privilege. And I am very grateful myself to have been associated with that range of fields and professions over the course of my professional life, and certainly as the daughter of a nurse, and certainly to be associated with what you're celebrating here today and recognizing the honor of your profession. So congratulations again on the 75 years, but more so, congratulations on what you do every day to prepare students who come to San Jose State to work somewhere around and in and near that crucible of the bedside. So welcome, congratulations, celebrate wildly today, you absolutely should, and I want to thank you again for everything that you do. Thank you. I have a gift.
And of course, there's chocolate. Our second welcome is provided by the Dean of the newly named College of Health and Human Sciences, Dr. Mary Scutton. Dr. Scutton came to San Jose State University in July of 2015 from Grand Valley State University in Michigan, where she was the Associate Dean of the College of Liberal Arts and Sciences. Prior to joining Grand Valley, Dr. Scutton was chair and professor in the Department of Health, Physical Education, Recreation, Dance, and Sports at Calvin College in Grand Rapids, Michigan. Dean Scutton has a background in physical education with a focus on motor control and health education. Her research interests include the use of technology in physical and health education, student success, and exercise science. Since arriving at San Jose State University, Dean Scutton has been a true advocate for student success and is very supportive of the efforts to help students complete their educational program. Please welcome Dean Scutton to the podium.
Thank you so much. First, thank you to Wynn for those kind words and for chairing the committee that ultimately chose me to come here. So I'm deeply grateful for that as well. She also told me I get to lecture because I don't get to do that enough, so I'm just going to go 45, 50 minutes. And I just want to tell you in my syllabus that this is the A row, and the back row, you're in the F row, so you should think about relocating as you do that. Yes, I see some of you are fulfilling your destiny back there. But I, like everyone else, happy birthday. Let's hear it. You're 75. It's fantastic. It's a fantastic thing. And when I did think about some things, my associate dean is one of you. She's a former faculty member, Pam Richardson, and we're engaged with Dominguez Hills right now and trying to get ready to persuade the legislature on why the CSU, the California State University System, should offer a clinical doctorate in OT. So I've gotten a lot of time to see what amazing things are going on. I've also interacted with several of the alums across my first 3 years here, and you're a group of superstars, and don't forget that. And this year, I want to talk to you a little bit about points of pride we have for you, but one thing happened on the first day. Certainly, we've been talking about change for a few years, and we did effect a new name for the college. And again, Health and Human Sciences is our name. We feel it's more reflective of the kind of interdisciplinary, community-based work that we're involved in as a college and all the connections that we have in making society better. The second thing is, at that meeting, the former director of the nursing school came up to me and handed me Money Magazine, and this was the first time we saw this. Money Magazine listed San Jose State as the fourth most transformative college in the United States. Okay. I certainly shared that. That's been on our website, the university's website and more, but let me tell you what they said that means, though, is that what it means is it's impressive when a college helps students do far better than would be expected, given their academic and economic backgrounds. Of course, you and OT have been transformative in your program since your inception in the 75 years you've been here. So a few examples for you, for those of you who aren't aware of how transformative you are and how much you impact the health of our community and society. First of all, the OT department has thousands of alumni throughout the state of California and around the world who've made important contributions to research, practice, and advocacy in occupational therapy. And here I think is a really important one for you to know too, is that due to our San Jose State student diversity, our program contributes substantially to the cultural diversity of the entire occupational profession nationally. So you bring a variety of perspectives, and that's so much needed in the culture of healthcare. You've long been an innovator in graduate-level education in occupational therapy. This I didn't know, but in 1960, you offered a master's degree. And in 1999, you introduced the first fully online degree program at San Jose State, which was also the first online master's program in occupational therapy in the United States. So you've been trailblazers. I see people nodding as though you already know this. So I'm educating myself, but I think you ought to know how important the history of your program is to the success that you have and why you are so welcomed when you're out in the profession as well. From the beginning, the hallmarks of this program has been hands-on or applied instruction and service to the community. Today's students engage at the local, state, national, and international levels. So the department's operated on-campus clinics, offering free or very low-cost therapy services to members of the community since its inception. The first occupational therapy program in the United States to do so. So you were number one, even though the profession had 25 years on you, because I think you had the 100th last year, right? Or recently? Yeah, so you're first clinic. How amazing is that? And certainly we want to tell our legislature about that as we move to other graduate degrees. The clinics are certainly important for the community-based therapy services for the medically underserved in Santa Clara County, and there's always a wait list for that clinic. And of course, our student feedback is that over the years has consistently put the participation in the clinics as one of the most important pieces in their education and professional development. You also have expanded your visibility in the community when you added a community-based practice component to your curriculum in 2013. Under the guidance of faculty and a very strong faculty core, the students conduct needs assessment and provide no-cost program development, program implementation, and evaluation services to the community-based nonprofits based on the needs and desires of the organization. Students, we were talking about, Wynn mentioned that we're moving on the RISCA or Research Scholarly Creative Activity time here and trying to enhance or carve out more time for our faculty to engage in that process because it's so important to the profession and so important to teaching. Many students present their projects at poster sessions at state and national conferences, averaging 50 students and 10 peer-reviewed presentations each year. We also have a very active student occupational therapy association, a chapter of Phi Theta Epsilon, the OT Honor Society, a pre-OT club for undergraduate students. The groups engage in service, social and scholarly activities, and they've been recognized by university and national professional entities for the work they've done. The Department of OT has been a leader in the College of Health and Human Sciences Global Experience or International Experience Initiative. Over 80% of our students have participated in the international programs while attending San Jose State. It includes courses led by San Jose State faculty, service learning experiences internationally, and global interdisciplinary courses and programs. The OT department has developed partnerships and student exchange programs with universities in Finland and Taiwan, helping to globalize the curriculum and the university. The retention and graduation rate for this program is close to 100%. It's that dedication of the faculty, and again, you heard my bias towards student success, so of course I really like that one, because to me that's really successful if they stay here and successfully complete the program, which they do at a 3-year average of just under 98% pass rate on the OT exam. So fantastic preparation, fantastic activity. The quality of the program is due in large part to the many dedicated and distinguished faculty members who have served over the past 75 years. Some of the faculty accomplishments across that time include authorship of 2 of the core textbooks in occupational therapy, a recipient of the highest honor of the profession, the Eleanor Clark Slagle Award, numerous faculty serving in leadership roles in state and national professional organizations, several fellows in the AOTA group, a Fulbright awardee, and an SJSU Outstanding Professor. Welcome back to SJSU. I know that you'll join me in saying how proud we all are in this program's impact in society, a transformative leader in healthcare. Have a great day.
Thank you, Dean Scutton. And our third welcome is provided by Dr. Heather Kitching. Dr. Heather Kitching is the president of the Occupational Therapy Association of California. She completed her Bachelor of Science degree in Occupational Therapy from Quinnipiac College. She was one of my students there. I had to put that in. And has advanced degrees in Occupational Therapy from the University of Southern California. Dr. Kitching has a strong background in occupation-based practice and was an occupational therapist at Rancho Los Amigos for several years. She has held both elected and appointed positions at the local and state levels with the Occupational Therapy Association of California. She has served the American Occupational Therapy Association on the local conference committee and as a member of the Affiliated State Association Presidents. Prior to being elected president of OTAC, Dr. Kitching held the position of vice president and president-elect, including a 2-year appointment to the California Foundation for Occupational Therapy as the liaison from OTAC. Dr. Kitching is currently a faculty member of our sister school, CSU Dominguez Hills Occupational Therapy. Please welcome Dr. Kitching to the podium.
Wow, this is a celebration. Very exciting to be here and very humbling to serve as the president of the state association. We have at least 2 past presidents with us here, Richard Bookwalter and Shawn Phipps, and I would be here a long time talking to you if I listed everybody else in the audience. There are a number of people here, both graduates of the program and faculty who are the most dedicated, long-serving volunteers within our association. So to back up from that a little bit, I wanted to share with just a little bit of sadness that I can't claim being a graduate of this program, but I do want to say a few things about my relation to this program because I have a deep, deep respect and positive regard for it. I was also going to tell you that Winifred Schultz-Krohn and I met in 1989. I'm not sure she's aged a day since then. I have, however. That's another topic. But we did meet. I was a junior in my undergrad program. She met me in a very young version of myself, and for that I say I'm sorry. But we met then, and then I came to California first, actually. I came out for field work in 91, and then she followed a few years thereafter. And to see her at an OTAC conference was an amazing experience. I grabbed her and hugged her. And since that time, as I ventured into teaching, I returned to graduate school at some point in my career, ventured into teaching, and the 2 people who taught me everything I first learned about teaching were both graduates of San Jose State, Dr. Janie Taguchi-Meyer and Dr. Julie McLaughlin-Gray, 2 of my most dear mentors who continue to contribute greatly to the profession. So I met Winifred in '89, and then I was mentored by San Jose graduates, and then of course my being enfolded into all levels of leadership within OTAC had me crossing paths with all kinds of San Jose faculty and graduates. So I like to think of myself, you know, if you imagine this like a family reunion, I haven't graduated from here, but I think of myself as like a Spartan, like once removed or twice removed. I'm never quite sure how that removed business works, but I know in my heart somewhere I am a Spartan. At least a little. Is that okay with the Spartans? Yeah. Thank you. What a warm response. Thank you. So OTAC this year has decided to really embrace the words of past AOTA President Ginny Stoffel. She did some nice writing on the concept of building capacity, what it takes over time to build clinical expertise, leadership expertise. She's really laid out some beautiful work for us to understand how to move ourselves as individuals and a professional community from a place of not always knowing what we don't know to increasing what we do know and using that to make a positive impact. So we're using that framework to move both the association leadership forward as well as the profession across California. I do hope many of you will be with us later this month at our conference. We really need to be a unified profession, a unified community. And of that, I'm very proud. I'm very proud that I'm a part of Dominguez. I'm very proud that I've been to school at USC, and of course that I started on the East Coast at Quinnipiac. I actually have these bracelets. They carry both of my schools on my wrist at all times when I come to things like this, because I do think we're stronger all together, and that's really the beauty of OT practice in my mind. So let's build capacity together. Let's be a unified group. We are over 16,000 strong in California, inclusive, of course, the number would be larger if we talked about all of the San Jose graduates who've moved beyond California. So it's a great honor to be here. It's a great honor to serve as the State Association President, and it's a tremendous honor to call all of you colleagues and friends. Enjoy the day.
Thank you very much, Heather. It's now my great honor to welcome our keynote speaker and alum of San Jose State University to the podium. Dr. Shawn Phipps is the Chief Quality Officer and Associate Hospital Administrator at Rancho Los Amigos National Hospital Center in Los Angeles, California, where he has served for 21 years as the occupational therapy practitioner, clinical specialist, supervisor, manager, and chief. So again, somebody who can wear multiple hats. He is the past Vice President and Board Director of the American Occupational Therapy Association and currently serves as the California representative to the American Occupational Therapy Association Representative Assembly. Dr. Phipps has also served 2 consecutive elected terms as president of OTAC and serves as adjunct faculty and a member of the Board of Counselors for the University of Southern California Chan Division of Occupational Science and Occupational Therapy. He has published and presented extensively at the state, national, and international levels. Dr. Phipps was inducted as a Fellow of the American Occupational Therapy Association in 2011, was a recipient of the AOTA Cordelia Myers Writer Award in 2008, and the OTAC Practice Award in 2005, and was the 2014 recipient of the OTAC Award of Excellence. And in 2015, the AOTA recognition and achievement for excellence in leadership, management, and administration. He is a proud alumnus from San Jose State University's Post-Professional Master of Science OT program, class of 2002, where he published his master's thesis in the American Journal of Occupational Therapy, where he was the winner of the AOTA Cordelia Myers Award for Best AJOT article. He has taught the Leadership and Management course from 2011 through 2014 in the Post-Professional Master's program. He was also elected as the SJSU OT class speaker at the graduation in 2002 and was the recipient of the 2012 SJSU Occupational Therapy Distinguished Alumnus of the Year. Please welcome Dr. Phipps to the podium.
Thank you, Wen. How does it feel to be 75 years old? Is 75 the new 55? It's been 5 years since I've been on this campus, and I can't believe how much has transformed. What do you think of this new space here? Isn't this fantastic? And, you know, we're going to be going down a little bit of history lane here. Was anybody here at the 50th anniversary by any chance? Oh, yes. Do you recognize any familiar faces there? Lorraine Pedretti, who was the keynote speaker at the 50th anniversary. I see Fred Salmons in there. Claudia Allen. Amy Killingsworth, is she here? Yeah? So, yeah, this is a very exciting time in San Jose State University's history. I'm very proud to be here with you today, and hopefully this will be a fun journey looking back in time, but also looking towards our future. So, did anybody recognize those OT signs that were kind of staked into the ground with the arrow pointing to where you needed to go? Those also came from the 50th anniversary as well. Nice stenciling job, right? I'm sure it was part of an OT class. All right, let's see. Okay, so let's go back to 1942 when the San Jose State University Occupational Therapy program was started. It started with Susan Richards. Did anybody know Susan Richards? Don't feel bad about dating yourself here. This is a safe zone. But she was an occupational therapist that worked at Children's Hospital in Oakland and was asked by the head of the art department here at San Jose State University to teach a course in occupational therapy. It was Art 7, Occupational Therapy Theory, and it was described as an introductory survey of occupational therapy, history, theory, and practical applications. This was from the undergraduate bulletin in 1943, and the photo down at the bottom apparently was the building where this particular course was housed. Is this building still on campus? Yes, so what's it called now? Art. But, so, things were going well, and in 1943, Susan Richards eventually left her clinical position at Children's Hospital of Oakland to head the inaugural San Jose State University OT department, so went from just a course to an actual department in 1943, in the middle years of World War II, when there was an urgency to start occupational therapy programs whose graduates could contribute to the rehabilitation of soldiers returning with war injuries. During that first year, Mrs. Richards started the senior laboratory courses, which involved patient treatment. Again, the dean was mentioning how unique San Jose State was in actually creating clinics here on campus. This departure from a standard college teaching format, however, resulted in some administrative difficulties with the art department. And in the fall of 1944, the occupational therapy program was placed in the natural science department. It moved from the comfortable, warm, and colorful quarters on the second floor of the art building to a gloomy, cold basement room in the old science building. Is that building still here? Oh, is it still gloomy? Yeah. Mary Booth was appointed assistant professor in charge of the occupational therapy program in 1944 and was appointed the director of the program in 1948, and there she is with a client providing occupational therapy intervention. And by 1952, enrollments had increased to 193 students, making it the second largest occupational therapy program in the country, and eventually the largest international OT program in 1957. And there's a nice little article there that showcases that OT at San Jose State University is the largest program in the world. Isn't that amazing? And then the state legislature got involved and budget cuts happened, you know. The first Master of Science degree in occupational therapy from San Jose State University was awarded in August of 1961 to Barbara Pickett. Did anybody know Barbara? Okay. And how many of you know about Diane Fossey? Okay, the occupational therapist and anthropologist, Dr. Liz Kerr, I don't know if she's here, but has done extensive work and I believe is writing a book on the life of Diane Fossey. But she undertook an extensive study of guerrilla groups over a period of 18 years. She studied them daily in their mountain forests of Rwanda, initially encouraged to work there by the famous anthropologist Louise Leakey. And she was a graduate of the San Jose State University Occupational Therapy Program in 1954. Unfortunately, she was assassinated in December of 1985, but her memory lives on through the movie that came out in 1988 with Sigourney Weaver starring in her character role in Gorillas in the Mist. How many of you have seen Gorillas in the Mist? Yeah. So lots of really wonderful history here at San Jose State, and it gets even better. Dr. Lily Lawrence, who doesn't love Dr. Lawrence? She's just an amazing occupational therapy leader that was ahead of her time. And she was appointed chair of the occupational therapy department in 1983 and would serve as chair until 1995. Did you know that San Jose State, and the dean kind of touched on some of the statistics here, but you're ranked number 2 in California by the U.S. News and World Report, and you're ranked the number 1 public occupational therapy program in the West by U.S. News and World Report. That's pretty significant, right? That deserves a round of applause. Here's some other historical accomplishments, many that the dean actually touched on. Dr. Ann McRae started the online post-professional master's program in 1999, which is the program that I graduated from in 2002. I was in the second cohort. Anybody here alum from the post-professional master's program? All right. And then I actually was able to teach in that program from 2011 to 2014, and unfortunately the enrollments went down in that program, but it was absolutely pioneering because it was the first accredited post-professional online master's program in occupational therapy, and now you see them all over the country. We also have several Eleanor Clark Slagle lecturers, including Dr. Lorenz, Claudia Allen, and Dr. Kay Barker Schwartz. Everybody's familiar with the Pedretti textbook. We have many, I think we're raffling one of those later today, right? Oh, it's a drawing. And of course, it's now being edited by Dr. Heidi Pendleton, who's here with us. Heidi. And Dr. Winifred Schultz-Krohn. Now in its 8th edition. And the textbook Psychosocial Occupational Therapy and an Evolving Practice was edited by Dr. Elizabeth Cara and Dr. Ann McRae, and now it's going to be in its 3rd edition, or maybe fourth edition, I believe, this coming spring. Other textbooks with contributions from our faculty here at San Jose State include Occupational Therapy for Children, Occupational Therapy Without Borders, Willard and Spackman, Assessments in Occupational Therapy, Best Practices for Occupational Therapy in Schools, several publications and peer-reviewed publications such as AJOT, the OT Journal of Research, the Journal of Physical Therapy, Journal of Occupational Science, Physical Therapy and Healthcare, Psychiatric Rehabilitation, Occupational Therapy International, British Journal of Occupational Therapy, and Occupational Therapy and Mental Health. So San Jose State is all around the world. We also have fellows from the American Occupational Therapy Association, including Dr. Lorenz, Karen Diazio, Saret, Dr. Kay Barker Schwartz, Dr. Winifred Schultz-Krohn, Dr. Heidi Pendleton, Dr. Pamela Richardson, Dr. Ann McRae, Dr. Marty Southam, Dr. Gigi Smith, and myself. We also had a Fulbright scholar, Dr. Ann McRae, and by the way, I knew that there was the possibility of leaving somebody out, so I actually vetted this all through Winifred. Said check, double check, triple check, because make sure that there's going to be that one faculty member that got left off of there. So please let me know if there's any additions. By the way, if you are in the audience, we would like to recognize you as we actually share some of these accomplishments. So if you could just briefly stand up if your name comes up on this list. There's also the San Jose State University Teacher Scholar Award, which has been awarded to Dr. Heidi Pendleton. Dr. Ann McRae, Dr. Liz Cara. Is Liz here? No? And she's on vacation. Okay. I thought she was retired. Isn't that like permanent vacation? No? And then Dr. Winifred Schultz-Krohn, of course, who also had the Outstanding Professor Award. Dr. Pamela Richardson, one of my mentors and the person that actually co-authored the AJOT article that won the Cordelia Myers Award, is also on the NBC OT Board of Directors. Where are you, Pam? Oh, there you are. We also have Dr. Len Andonian, Dr. Winifred Schultz-Krohn, and Dr. Megan Chang on the AJOT editorial board. Dr. Heidi Pendleton and myself have served in the AOT Representative Assembly. I've served on the Board of Directors and also as Vice President. We also have a past chair of the Commission on Competence and Professional Development, Dr. Winifred Schultz-Krohn. Chair of Bylaws, Policies, and Procedures, Dr. Winifred Schultz-Krohn. And do we have Dr. Deborah Bolding here with us today? She's at her daughter's wedding. That takes precedence, right? All right. There's also been involvement in several editorial boards, including the Occupational Therapy Journal of Research, the Occupational Therapy and Education and Early Intervention, Occupational Therapy International, Canadian Journal of Occupational Therapy, South African Journal of Occupational Therapy. There's been international consultations and teaching in Malta, South Africa, the Philippines, and Taiwan, and several international presentations for the World Federation of Occupational Therapists. So lots of really wonderful accomplishments to really celebrate here at San Jose State. We've had 5 presidents who are alums of San Jose State, including Doris Cutting from 1978 to 1980, Ardith Breton from 1988 to 1990, Janet Jabri from 1990 to 1992, Richard Bookwalter, I believe, is here, from 2006 to 2008, and myself from 2008 to 2012. Some other OT historical accomplishments. Dr. Gigi Smith is currently the secretary of the OTAC Board of Directors. Gigi, you can stand too. And past co-chair of the Government Affairs Committee, and I know several other positions because we were actually chapter directors together in the early 2000s before the regional system. Past OTAC Political Action Committee chair. I actually recruited the cheerleader herself, Winifred Schultz-Krohn. Our California Foundation for Occupational Therapy honored lecturers included Dr. Heidi Pendleton, Dr. Marty Southern, Dr. Kay Schwartz, Dr. Pam Richardson, Dr. Winifred Schultz-Krohn, Dr. Deborah Bolding, and Dr. Gigi Smith is going to be the CFOT honored lecturer this year. And Dr. Louis Arabit, one of the newest faculty members here at San Jose State. You guys are so lucky to have him. You grabbed him from Southern California, brought him out. And he's a past OTAC vice president and AOTAPAC Region 5 director. And yes. And Brittany Moinerth, are you here? Yes, you are our current OTAC Region 3 director. Allison George is our OTAC student leadership chair. And what a fabulous San Jose State University OT faculty. Great photo, huh? All right, so obviously you guys have laid a strong platform for success for the future, and I really do believe that San Jose State plays a role in helping the profession at large move to its next 75 years. What are we going to look like when San Jose State turns 100 years old? You guys get to have your own centennial in 25 years. So we're going to talk about our future of occupational therapy, particularly as it relates to Vision 2025. How many of you have heard of Vision 2025? Okay, that's good. How many of you guys remember the Centennial Vision? Okay, it was a powerful vision that really propelled us forward as a profession and really helped to mobilize state associations, our national association, and I would actually say our world colleagues actually embraced the Centennial Vision as well. Do you guys remember that statement, that Centennial Vision? That we're powerful, widely recognized, science-driven, and evidence-based, with a globally connected and diverse workforce meeting society's occupational needs. It was wonderful. Healthcare's changed significantly since that Centennial Vision was written. We are now in a period of uncertainty in terms of what our healthcare system is going to look like, but we do know that there is a very heavy focus on quality, patient experience, and cost effectiveness. How many of you have heard of the triple aim of healthcare? This was actually published through the Institute for Healthcare Improvement, which is kind of a think tank out of Boston, Massachusetts, and really has transformed the way that we look at healthcare. It's a very simple model, but it actually requires us to really think differently about how we deliver healthcare. And so I challenge all of you as you think about Vision 2025 and the triple aim, how can we start to prepare our students, and how, as previous alum, how can we actually in practice start to really help the healthcare system proactively move to addressing quality, patient experience, cost effectiveness, and things like population health that we hear about, because that is the future direction. So I want to talk a little bit about the visioning process for Vision 2025. It didn't just happen miraculously. We knew in 2014 that the Centennial Vision was going to be ending in 2017, so 3 years in advance we really started working. At that time I was on the board of directors, and we brought together a group of over 100 representatives from the occupational therapy community, as well as healthcare industry leaders outside of OT that could give us feedback on where we need to head as a profession. We also brought in students, faculty, practitioners, new and old, and various stakeholders to really have a very diverse look at where we needed to head as a healthcare system and how we can position occupational therapy for success. So Vision 2025 says that we maximize health, well-being, and quality of life for all people, populations, and communities through effective solutions to facilitate participation in everyday living. Now, that seems like a very simple statement, but can you imagine how powerful our profession will be if everyone practiced in this way? You could say that with every client, regardless of what practice area you're in, that you are improving health, well-being, and quality of life for those populations, not just individuals, but actually you're making an effect for entire populations of people that we serve. That is really a powerful way to really express the depth of and the power of occupational therapy to transform lives. So it's really kind of helping us get out of the focus on just the individual that we serve, but the populations that we serve at large. So in this transition, we've been soliciting and organizing all the feedback that we've received on current practice and building on the Centennial Vision accomplishments. We didn't just abandon the Centennial Vision when we turned 100 years old. We said there were really good things that we need to continue on, such as diversity, which is still an area where we have a lot of room for growth, and implement goals and strategies to achieve Vision 2025. So there are 4 pillars that the Vision 2025 vision rests on and is central to helping us to effectively move to Vision 2025. The first is effectiveness, and that we are an evidence-based, client-centered, and cost-effective profession. The second focuses on leadership, where occupational therapy is influential in changing health policy, environments, and complex systems. So again, it's actually looking at leadership, not just within your clinic or your department, but looking at how we're actually developing leadership across systems. And then the third is our focus on collaboration, which we traditionally have been very good at. We're good collaborators. Sometimes we're not always at the table as a result, but we do like to collaborate with our interdisciplinary colleagues. But we also want to sustain our distinct value as an occupational therapy profession, and it really is a nice balance to be able to do that. And we also want to be accessible, meaning that people actually have access to their services. Those that need occupational therapy receive occupational therapy. So why is effectiveness foundational for our future? A profession cannot survive without objective evidence that it works. And all systems and payers are focused now on high quality and cost-effective outcomes. So gone are the days of just getting paid because you tried. You actually now have to really produce results, and you have to document that very clearly to payers. And it's actually going to become even more competitive as we move to capitated models where, for example, you're given a certain amount of funding to manage an entire population of patients and clients that you serve. And if you do that well, if your patients actually improve significantly and you're able to do it at a reduced level of cost, you're actually going to thrive more as a practitioner and as a profession. So some of our challenges in this area of effectiveness are that applying the evidence in a client-centered, occupation-based, and cost-effective manner sometimes has constraints in real-life clinical situations, especially with high levels of productivity, especially in the skilled nursing facilities. I really think this is one of probably the more pressing challenges in our profession right now. How many of you work in skilled nursing facilities? Is there anybody here with over 90% productivity? A few in the back there. I just don't think that's realistic. And I don't know if quality is really the focus when you have that kind of productivity level. That's a whole other topic. We also need to convince our supervisors and our peers to practice and document in new ways. How many of you are familiar with the occupational profile? And the tool the AOTA has made free, available to everybody, members and non-members, to be able to document their occupational profile clearly and effectively and consistently in the same manner. Some of our priorities at the AOTA level are creating research opportunities in collaboration with the Occupational Therapy Foundation. And there's a lot of wonderful collaboration going on with our foundation, and we're very, very happy about the direction that we're moving there. Assisting students and practitioners and educators and researchers to effectively apply research to practice through knowledge translation, and introducing federal and state bills and new regulations supportive of best practice with optimum utilization of occupational therapy consistent with the AOTA standards and policies. And these are just some of the resources, and I believe all of these slides are going to be available to the participants here today online. So I'm not going to go through those. So leadership is the second core pillar for Vision 2025. So why is leadership important? We need to create our own future, and if we don't define who we are and what we can do, others will definitely do this for us, for good or for bad, right? So some of our challenges with leadership in our profession are that individual practitioners may not consider themselves leaders, especially if that role is not reflected in their title. And I think our mantra these days is that it doesn't matter what your title is, what your role is, all of us have an opportunity to play a leadership role in the profession. It could be that you are the best practitioner on your interprofessional team. It could mean that you are developing innovative programs and thinking outside of the box in terms of your practice area. Leadership looks different across our profession, but all of you have the capacity for leadership. And my afternoon workshop is actually going to be focused on that for those of you that are going to be attending. And some practitioners equate leadership with promoting themselves or their ideas over others, which they aren't comfortable doing. And leadership opportunities are not always apparent because sometimes people are looking for a particular position, when again, they can play a leadership role in the position they're in right now. Some of our priorities at AOTA are to advance leadership skills and competencies of our practitioners, our educators, and our scientists, and provide the tools to help all practitioners realize their own leadership style and their potential so that they can be change agents and foster excellence in practice. And explore expanding the scalability of our emerging leaders program and our middle managers program. Both excellent programs, but we need to scale them to reach more people. And here are just a few examples of our leadership at the AOTA level. We have OT practitioners that are represented at the table with the American Medical Association, National Quality Forum, the Centers for Medicare and Medicaid, Substance Abuse and Mental Health Services Administration, and the National Institutes for Health. So we really are moving forward with really having a strong presence in Washington, D.C., on Capitol Hill, in policy and regulation, and it's in a very exciting time because our elected officials are seeing the value of occupational therapy being at the table. Collaboration is that third foundational pillar, which is looking at our team-based interventions and how critical that is for better outcomes and more cost-effective treatment. And working with clients and within systems is already a defining strength of occupational therapy. Some of our challenges are that the distinct value of occupational therapy may not fully be understood. Sometimes we get into that trap. And occupational therapy is not always at the table when policy and healthcare decisions are being made. So what are some of our priorities at the AOTA level for collaboration? We're working very hard to promote the distinct value of occupational therapy and the resources we provide to students and practitioners to articulate their scope of practice, to interprofessional team members, how to help occupational therapy leaders get onto key legislative and regulatory committees, providing practitioners with the tools to develop quality measures that demonstrate occupational therapy's distinct value and effectiveness outcomes, and focusing advocacy activities around promoting the value of occupational therapy to ensure inclusion in policies and systems. And then that fourth pillar is focused on accessibility. So why is accessibility foundational for our future? We need to be able to show our ability to be accessible and affordable to the members of the populations who would benefit from our services. And to be client-centered, we must be culturally responsive to the changing populations that we serve. Some of our challenges are the changing healthcare system that sometimes restricts payment for OT and other healthcare providers. And although improving, our workforce does not reflect the diversity of the people that we serve. We have a long way to go there. Some of our priorities at AOTA are focused on developing relationships with key members of Congress, regulatory agencies, state officials, and payers to help get favorable legislation adopted that supports access to high-quality occupational therapy services. Provide professional development that includes delivering culturally responsive services to diverse populations and expanding opportunities for underrepresented populations of practitioners to engage in the association and to increase their visibility in the profession. And so I'm actually going to skip forward to the last part of our presentation, which is a question for all of you. How will you personally use all of these ideas that we've talked about to make Vision 2025 a reality? I want you to think about this afternoon as you go to your sessions, and I hope that it will stimulate some dialogue in some of the sessions that you're going to be attending in terms of what this means for you personally as a contributor to the future success of the occupational therapy profession. We have a wonderful vision that we are looking towards, but we need everybody on board to make this vision a reality. So I thank you for your attention. It's been an honor to be your keynote speaker today, and I look forward to seeing some of you in my workshop this afternoon and at the reception this evening. And thank you to Dr. Winifred Schultz-Krohn for inviting me to be your keynote speaker. Thank you so much.